Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. The nurse considers that a 70-year-old female can best limit further progression of osteoporosis by taking supplemental calcium and vitamin D, increasing the consumption of eggs and cheese, taking supplemental magnesium and vitamin E, increasing the consumption of milk and milk products. The answer is taking supplemental calcium and vitamin D. Research demonstrates that women past menopause need at least 1,500 milligrams of calcium a day, which is almost impossible to obtain through dietary sources because the average daily consumption of calcium is 300 to 500 milligrams. Vitamin D promotes the deposition of calcium into the bones. The female client has just spent 5 minutes complaining to the nurse about numerous aspects of her hospital stay. Which is the best initial response by the nurse? Attempt to explain the purpose of different hospital routines to the client. Explain to the client that becoming so upset dangerously blocks her need for rest. Refocus the conversation on the client's fears, frustrations, and anger about her condition. Permit the client to release feelings and then promptly leave to allow her to regain composure. The answer is refocus the conversation on the client's fears, frustrations, and anger about her condition. This provides the opportunity for the client to verbalize her feelings' underlying behavior. Polycythemia is frequently associated with chronic obstructive pulmonary disease. When assessing for this complication, the nurse should monitor for pallor and cyanosis, dyspnea on exertion, elevated hemoglobin, decreased hematocrit. The answer is elevated hemoglobin. The body attempts to recompensate for decreased oxygen to tissues by increasing the number of blood cells, the oxygen-carrying component of the blood. A male with chronic liver disease reports that his gums bleed spontaneously. In addition, the nurse identifies small hemorrhagic lesions on his face. The nurse concludes that the client needs additional bile salts, folic acid, vitamin A, vitamin K. The answer is vitamin K. Fat-soluble vitamin K is essential for synthesis of the prothrombin by the liver. A lack of vitamin K results in hypoprothrombemia, inadequate coagulation, and hemorrhage. During the evening after a paracentesis, the nurse identifies that the client, although denying any discomfort, is very anxious. The best nursing approach is to offer the client a back rub, administer the prescribed opioid, reinforce the practitioner's explanation of the procedure. Explore the client's concerns while administering the ordered anxiolytic. The answer is explore of the client's concerns while administering the ordered anxiolytic. Sharing and discussing concerns often release anxieties. Giving the ordered anxiolytic will produce relaxation. A client visits the clinic because of concerns about insomnia and recent weight loss. A tentative diagnosis of hyperthyroidism is made. In addition to these changes, the nurse further assesses the client for increased appetite, recent weight loss, feelings of warmth, fluttering in the chest. The answer is recent weight loss. Excessive metabolic activity associated with hypothyroidism causes fatigue. A client with peripheral arterial insufficiency tells the nurse that walking sometimes results in severe pain in the calf muscles. This type of pain is called rest pain, intermittent claudication, phantom limb sensation, Raynaud's phenomenon. The answer is intermittent claudication. Intermittent claudication is pain that results when the arterial system is unable to provide adequate blood flow to the tissues in the presence of increased demands for oxygen and nutrients during exercise. It is relieved by rest. A 32-year-old woman is brought to the emergency service with complaints of epigastric pain and prolonged vomiting. Her respirations are rapid and shallow, her skin is dry and flushed, and she appears weak and lethargic. As a result of a client database, the primary nursing concern is acute pain, risk for injury, metabolic alkalosis, ineffective breathing. The answer is metabolic alkalosis. Prolonged vomiting results in fluid loss. The client's adaptations reflect dehydration and metabolic alkalosis. When discussing future meal plans with a client who has a hiatal hernia, the nurse asked what beverages the client usually enjoys. The beverage that should be included in the diet when the client is discharged is ginger ale, apple juice, orange juice, cola beverages. The answer is apple juice. Apple juice is not irritating to the gastric mucosa. A client is instructed to avoid straining on defecation postoperatively. The nurse documents that the related teaching is understood when the client states, "I must increase my intake of ripe bananas, milk products, green vegetables, creamed potatoes." The answer is green vegetables. Green vegetables contain fiber, which promotes defecation. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.